Hey there, friends. I'm doing this on Sunday, so 37 days post-op. 2 days ago, on Friday, I hit my 5-week post-op physical therapy appointment and wanted to give some updates on where I am at the roughly 5-week mark. Um, of course, there's the general progression of things in terms of how much range of motion I have and feeling a little bit stronger. I'll show you a little bit of that, just kind of pacing around here and kind of how I'm moving. But in general, I'm seeing a progressive improvement in terms of what I'm allowed to do and what I feel comfortable doing. So one of the big ones is that I was cleared this week to start walking around without my brace locked. I believe that was this past Wednesday, so at 33 days post-op. And that was a big deal because locking my leg into extension while I'm walking around out in public is kind of irritating. My knee wants to bend, it wants to move, and so it's good that we've gotten to a point where my therapist feels comfortable with it, and I feel comfortable with it as well. So that's a big one. I was also advised to start spending some time in the pool, so I'm looking to do that. Just doing some exercises where there's a little bit of pressure from the water all around the knee, but the motion is such that the changes in forces aren't quite as unpredictable, I suppose, or at least aren't quite as extreme in terms of the swings. I'm looking forward to doing some of that. I'm still going to physical therapy twice a week, typically Wednesdays and Fridays. That's how it goes. So the next time I go will be this coming Wednesday, so it'll have been 5 days, roughly, since my therapist previously saw me. And I kind of like that because generally, with the whole 5 days that pass, I've got some progress that I can report since the last time I was in there. It's a long enough period of time that there can be some meaningful, kind of noticeable improvement. So that's a big deal. I'm getting up and down stairs a lot better now. I'm still keeping one hand free, but I'm not needing to perch both of my hands, like you can just barely see. Say the armrests on my chair here, if these were the handrails, I was often having to put my weight on both of these as I stepped down with my good leg, because lowering myself with the surgical leg was just too hard. I've gotten to where I can actually do that pretty easily just with my right hand on the rail. And same way that you would use, in your opposite hand, or just holding the wall or using a cane or whatever. I can actually go down without any assistance at all. I'm a little rougher. The movement's not as smooth when I'm stepping down with my right versus stepping down with my left, because my left is still a little weak, eccentrically lowering me. If you want to say eccentric, I'm not going to get into the biomechanics of it. But basically, the quad strength is getting there, but it's not where it needs to be, obviously, for me to be able to do this effortlessly. But it's progress. I'll attach a video to the end of this. I'll try to get that tacked on, showing that. And also another just quick clip from the exercises I'm doing. One of the exercises. The exercises have progressed, so I'm doing more standing balancy kind of things, hip abduction, flexion, extension exercises, adduction as well. Not just lying down, I'm doing them standing now with both sides. So standing on the good leg, moving the surgical leg, and then the opposite, standing on the surgical leg. Normally I need a little help balancing, and then doing the movements with the other. If you've never done standing exercises, where you, just push this over to the side here. If you've never done a standing exercise before, like this, it's not just a challenge for if I have a band attached to this leg. It's also a challenge for the leg I'm standing on. So both are involved. They feel a little different, but they are both involved. And so that's kind of a big deal. That I'm doing more of those. I'm still doing things like, Palloff presses while standing on something kind of unstable, or keeping my legs just aligned. So I'm standing on a line here, basically one foot in front of the other. That's tricky. We take that for granted when both of our knees are intact. So I'm doing that. The cycling is going really well. I've been able to actually start using a little resistance, at least at the clinic. And I'm cycling faster for longer, and the knee seems to be taking it pretty well. And I'm able to just sort of swing through a lot better than I could before. So that feels like really good progress. In terms of how I'm moving, since I'm standing up, walking backwards is not a big deal. I'm getting to where I'm kind of moving side to side better. I'm not doing explosive cuts or anything crazy like that, but I can turn and move and do basic stuff throughout the day without too much difficulty. I can actually turn, and my knee actually just popped there. not in a bad way. It does that periodically as it's, I think, starting to loosen up and get used to feeling like a knee again. And I can pivot. I'm still taking a lot of my weight off of this as I pivot. I don't want to, tempt fate, but I'm able to put more weight on it. Here's a big one. Standing on one foot. Obviously, if I'm standing on my right foot, the non-surgical knee, no big deal. I can stand here all day, especially because I am a martial artist, at least a mediocre one. So I've started, now that I have enough extension, doing some stuff, sometimes with little assistance with my hands, but trying to get used to just holding and slowly moving through some of my kick positions again. But I can also stand on this leg. I can't do what I just did, but I can at least stand here, lift my leg up, and kind of do a little bit of balancing. And while I'm not going to be throwing explosive kicks anytime soon, it's going to be a little bit before I get to that, I can put my pants on. I can put socks and shoes on more easily. Those little things, like sliding my shorts on by lifting this foot up and actually doing this. It took forever before I could do that with any confidence. So that's really good progress. And again, just being able to kind of, not only put weight on it when I'm perfectly stacked over my knee, but also put a little weight on it from the side and everything. It's just feeling a little bit more normal, I guess. Now I have to be careful because my understanding is that the ligament actually gets weaker for a period of a few months before it starts to get stronger again. It's it's really strong when they first implant it, and then as the body starts assimilating it and the tissue sort of gets integrated in and treated as a proper ligament, things shift around and it becomes weaker. And so sometimes people get overconfident, they return to sport too soon because the rest of them feels really good, but they don't know that the ligament's actually really weak and they risk re-tearing. So I want to be careful about getting too overconfident. But the movement's pretty good. Also, if you want a close look, prop this up again, and this is getting a little bit easier each time, being able to put my knee up on a chair. But it's a nice clean line. Things are feeling pretty good. The movement at the top is getting pretty good, and down at the bottom getting a little bit more movement. Most through the middle here, it's kind of stuck. We're going to keep working on this for a while. The swelling is taking its time to go away, but it does still feel like it's softening a bit. So we're just going to keep working on it. I don't know if you can see in the camera there is a little bit more depression without having to push in as hard. So it's like some of the swelling has come to the surface and it looks like it feels a little softer, which suggests to me maybe it'll start moving out a little more easily. I'm not getting the swelling at night. I'm not getting the major soreness anymore. You can see I still have kind of like some swelling here around the back, like the bottom of my hamstring. But it's manageable. It's not too bad. I'm past the worst of it, I think. I'm at a point now where I'm getting around in public. Things are going okay, and it's not too bad. What I might do soon is show a series of the exercises I'm starting to do, because I'm starting to do, or have been doing, like I said, cycling, glute bridges, standing band kind of things. So I can probably rig up a few of those and show you some of what I'm doing soon. So this coming week hits 6 weeks. That would be a good one. Like, here are all the exercises I'm doing right now at 6 weeks, and here's how I'm feeling. So if you want to see that, definitely stick around for that. Final point before I end this and tack on a couple of the other little clips is that I'm going to be going back a week from tomorrow, a week from this Monday coming up. So a little after I hit the 6 week mark, I'm going back for my second follow-up with my surgeon. And I'll be able to discuss the procedure with him a little bit more, I think, and also get some clarity or clarification on a couple of things regarding the nature of the surgery, how it was actually done, and if there are misconceptions. I think there might be something I kind of misreported about how it was actually done. I want to clear that up, so you can kind of come with me on that, and as I get either set straight on it or as we at least elaborate on what was really done. So if that's interesting to you, stick around for that. Of course, you can leave a comment. Let me know if you want to see anything in particular, if you have questions about anything, how I'm dealing with it. Note that my case is just my case. So if you have a similar surgery or the exact same procedure, your body's different, your situation's different, your surgical team and therapy team would be different. So, your mileage can and will vary, and I'm not anybody to model your expectations off of. I'm just a data point. But hopefully this helps you out, and I'll leave it at that. So stick around. I got a couple minutes of little clips just showing how I'm getting down the stairs now, and also just a little knee extension exercise that I'm doing at the clinic, just so you can kind of see. Doing a little bit of weighted knee extension stuff, just a couple of pounds on my ankle, but we're getting there, right? So thanks for watching, and I will catch you all next time.
And here I am doing another little supplemental recording about 5 weeks. 5 weeks in a day. Yesterday made 5 weeks. I still have a habit of holding the rail here, but I don't actually have to. So I'll keep my hand in the frame, my other hand's holding the camera. I can now walk downstairs without using the rails. Now, I'm still kind of falling more on one side than the other, but it doesn't really hurt too bad. And it doesn't hurt at all. If I do use the handrail, it's just kind of like a little bit of lightweight. I lean to my right a tiny bit, and it's really not a problem at all. But I've progressed to the point where I can walk downstairs without, whoop, as long as my heel doesn't clip the stair, I can walk downstairs. There we are. I wouldn't want to do that all day. Not at that point yet, but it's progress. There we are.
So I've removed the audio from this just because I was in the clinic and I didn't want to risk having any kind of, having people watching the video overhear important or compromising information from the other patients who are in the clinic. That's also why I'm only showing my legs here. But this is one of the exercises that they have me doing now. They started putting a larger bolster under my legs just so I'm traveling through a little bit more distance, basically more extension, because I'm starting from a more flexed position as I go through space there. And my therapist seems to be pretty pleased with how we're doing. That's a 2-pound weight, I believe, right there. So it's not a ton, but it's a long enough lever that it still makes for a good challenge. And I can't extend as far on my left as my right. As you can see here, I have a lot more extension with my right leg because I actually go past 0. But that's where we are.